Good morning. I'd like to talk to you about the wellness exam and the parts of it that we go through. So of course we're going to go through your patient history and all the things that have gone on, that have happened to you, and try to determine the causes of any symptoms that you're currently having. During the actual physical exam, we're looking for what's called the vertebral subluxation complex. So vertebral bones of your spine. So you have 7 in your neck called the cervical vertebra, 12 in the mid-back called the thoracic vertebra, 5 in the low back called the lumbar vertebra, 5 fused bones that make up your sacrum, 3 fused bones that make up your tailbone or your coccyx. We refer to them as the number down they are with the first letter of the name: C1, C2, C3, T1, T2, T3, L1, L2, L3. Subluxation, so this is what chiropractic doctors correct. Sub, think of it like sub-zero, sub is less than. Luxation is another word for dislocation. It means completely out of the joint. So a subluxation means it's less than completely out of the joint. So when the bones of the spine misalign, they subluxate or partially dislocate. This puts pressure on the nerve and affects the function of wherever that nerve goes. So we do not correct complete dislocations, which don't really occur in the spine. They occur anywhere else: fingers, wrists, elbows, ankles, knees. You could have partial dislocations or subluxations anywhere in the body, and a chiropractic doctor is trained to correct those, not complete dislocations. Complex is more than one part. These are the different components that make up the vertebral subluxation complex. These are different parts of the exam. Also, we have individual bones that make up the skull, and those can move out of place and cause problems too. Between each bone and the next is a nerve that comes out, right, and goes to a different part of your body. So depending on which bone is misaligned, subluxated, depends on which nerve is being damaged, depends on what type of symptoms you might be experiencing. Also, the bone may be misaligned, damaging that nerve, but you may not have those symptoms yet. So some of the parts of the exam: abnormal motion or position of spinal bones can restrict your ability to turn and bend. So I'm going to give an example of that. So when the bones are in proper alignment, you'll have much better range than when the bones are out of alignment. So just by checking your range of motion, we can see if there's a good chance you have misalignments before I even check with my hands. Abnormal nervous system function, symptoms elsewhere in the body. So this has to do with the symptoms that we just went over on the first part of the consultation. So wherever your symptoms are, I'm going to look for damage to the nerves in those areas, explaining those symptoms, if that is the cause of it. Abnormal muscle function, muscles become tight and go into spasm. So there's a couple things that can happen to the muscles. So when the bone's out of place damaging that nerve, it can increase the signal or decrease the signal, going to the organ, muscle, or gland. So if it's going to the muscle and the signal increases, we get spasming. If it decreases, we get weakness. So I might find areas where your muscles are really tight, I might find areas where your muscles are really weak. As far as an organ or gland goes, we could get too much function, like a heart that beats too fast, or like a heart that beats too slow. There are different things that can occur from that misalignment. Abnormal soft tissue function, swelling and inflammation. This is talking about pain. So each joint should have a little spring to it, right? Just like you push on the tip of your nose. That's how much motion each joint should have. When they're misaligned, it's going to be like I'm pushing on my desk. They're not going to go anywhere, and you might notice, yep, I feel that, it's a little tender. Sometimes the bone's out of place, hitting a nerve, but it's not hitting any pain fibers. Sometimes I'll find bones that are misaligned, and you might say, nope, I don't feel anything, or I just feel pressure. Doesn't mean it's not out of place, just means it's not out in a way you can feel. Just doesn't always hurt. And the last part, abnormal function of the spine and body. Bone spurs and other abnormal bony growths attempt to fuse malfunctioning spinal joints. So this is the process the body goes through when it's misaligned. We'll take a look over here. So the disc dries up, the bone breaks down, and the nerve gets less and less healthy. So this is the body's correction for this. We want to get to this before the body does that. And as patients always ask me, is this just going to happen to me anyway? No, this does not have to happen. Under chiropractic care, you don't have to have that. So if we can keep proper motion to the spine and proper curves, you can keep a nice healthy spine for as long as you'd like. So I hope that helps explain the exam a little bit better. Of course, there's some other aspects to the exam. That's the structural part of it. Please be sure to like and share so people know what services we offer, and I hope you have a healthy day.